One of the other techniques we started using to reverse memory loss before we got into all this metabolic stuff was counterpulsation. Those of you that are interested in it, this book here by Dr. Braverman is a pretty good example of somebody going from conventional thinking. She was a cardiologist at the University of Pennsylvania. And in the beginning of the book, she basically said that she went out to a clinic in California. She never named the clinic, but Julian Whitaker wrote the foreword for the book. And she said she spent 2 weeks at this clinic and she was amazed at what she saw.
Here's a brief introduction to EECP. Dr. Edwards has 15 years treating patients with enhanced external counterpulsation. EECP is approved by Medicare and insurance for congestive heart failure, severe angina, and acute myocardial infarction. Dr. Edwards' focus with this machine is increasing blood flow in the microcirculatory system. It increases perfusion in all capillary beds and in all organs.
And as rampant as metabolic syndrome and small vessel disease is today, I don't think I could argue with that folks should be doing counterpulsation. But counterpulsation, like chelation, in my opinion, treats the symptoms. It's not treating the underlying cause, which is the glycation of the microvessels. And it's just purely acts mechanically, because when you put somebody on EECP, if you look at their normal blood pressure, say it's 120/80, what counterpulsation does is what's called diastolic augmentation. So on the EECP machine, their blood pressure might be 120/240, because during diastole, the machine squeezes all the blood out of your lower body and forces it up into the upper body. So it's mechanically forcing open those stiffened capillaries where we can get more blood, more oxygen, and more nutrients to the area that's in trouble. So to me, using EECP would be akin to using ozone. In other words, you're just getting more circulation and more oxygen into the area, but are you actually addressing the underlying pathophysiology? And I think in the face of, if you look at the markers, if the hemoglobin A1C is elevated, if they're small vessel stuff, if you want to do it by delayed capillary filling on their feet, or if you want to do it by using post-reactive hyperemia vascular studies, you need to address that also, because that's what's driving the whole underlying process. Because I think today, after 40 years of practice, I think cholesterol is either, the theory of cholesterol, it's either wrong or it's a minor part of what vascular disease is actually being caused by. Because now the debate going on in the cardiac literature, the establishment is aware of this. The debate going on is how do they measure it?
Do you think the leukoariosis is also related to MS?
Well, you're
White
aware.
plaques?
MS is probably a group of things. It's probably not a single diagnosis. So when you look at an MRI, you can't tell the difference between the scars from multiple sclerosis and the scars from leukoariosis, because I think MS is either an infectious disease like Lyme or something like that, or it's autoimmune. I don't. But do they overlap? Yes, I do think they overlap.
And Parkinson's?
Well, if you read Braverman's book, she actually has it in the latter half of the book where she goes into all the off-label uses she's using EECP for: erectile dysfunction, Parkinson's, memory loss, Alzheimer's. It even surprised me what she was doing with it. Because if you look at the epidemic of metabolic syndrome we're seeing in our population, everybody's obese, everybody's got blood pressure, everybody's got memory loss. I mean, it's very frightening. If these machines weren't so expensive, everybody should be doing this. I don't think anybody couldn't benefit from EECP, because all EECP does, if you want to distill it to its essence, it simulates exercise.